Hi, my name is Brianna, and welcome to my presentation. I'm a graduate student from the University of Texas at Austin, and I work in the lab of Dr. Chris Rylander. For this rapid-fire presentation, I will discuss how a two-material computational model can exhibit a non-symmetric dispersal volume, and why this finding is so important for our lab. The problem our lab is addressing is the treatment of glioblastomas. A glioblastoma is a tumor type that is known to be hard to treat for several reasons: tumor invasiveness, the high vascularity of the tumor, and the similar tissue type of the tumor to the surrounding tissues. Even though there are several methods to treat glioblastomas, the 5-year survival rate is about 5%. In order to address that, a new localized treatment known as convection-enhanced delivery was aimed to allow direct contact to the tumor, and has shown to be effective in covering about 20% of the tumor margin with a single catheter. Our lab has developed a multi-port catheter known as the Convection-Enhanced Thermotherapy Catheter System. The addition of the microneedles surrounding the catheter is aimed to increase the tumor coverage and the overall dispersal volume of the drug into the tumor margins. Our lab has previously looked at the dispersal volume of sets in a 0.6 weight percent agarose gel and used this data to inform a 2D single material computational model. However, the current model lacks the heterogeneity of a tumor in the brain. For this work, we will determine how a two-material model could affect the change in dispersal volume. For our heterogeneous model, we used a biphasic solute material within FEBio to model the 0.6 weight percent agarose gel. The geometry of this model is based off a single microneedle coming into contact with an area of the brain where two tissue types are adjacent to each other, such as gray and white matter, or tumor tissue and gray or white matter. The boundary conditions were applied in order to confine the material to a similar response as the 0.6 weight percent agarose gel. The solute was based on indigo carmine, a dye we use in lab to validate the dispersal volume in agarose. The effective concentration and the effective pressure were informed by the previous model developed by our lab, and the applied load is equal and opposite to the effective pressure. In order to introduce heterogeneity, we had two adjacent materials with different permeabilities come into contact with the microneedle. The upper region is determined by the previous model we used in our lab, while the other material, the lower region, is increased by either a factor of 3 or 8 in order to indicate a different material type. From this computational model, we will evaluate the dispersed volume in either materials within this particular object. This first model has two materials of the same permeability and shows a uniform dispersal volume. However, these two materials have a higher permeability in this lower region and show a pooling of the infused volume towards those regions, with the 8-fold having a little larger amount of volume being infused overall. This research highlights how two adjacent tissue types with unique material properties can affect the overall profile of the dispersal volume. It calls for more dynamic and well-informed parameters to create a truly heterogeneous brain model to track the flow of drug into the brain caused by the SETS device. Thank you for listening. If you have any questions, just email me or respond with a comment.